Good morning, everyone. Welcome. My name is Brandon Harris, and I'm delighted to have the opportunity to speak with you today about a critical issue in healthcare addressing healthcare disparities through systemic solutions and community engagement. This presentation is designed for a broad audience, including members of the general public, medical students, and healthcare professionals, so I will strive to make the information accessible and relevant to all. What exactly are healthcare disparities? Simply put, they are differences in health outcomes and access to healthcare services that exist between different population groups. These differences are often rooted in social, economic, and environmental disadvantages, and they can affect people based on their race, ethnicity, socioeconomic status, geographic location, sexual orientation, disability status, and other factors. Understanding these disparities is the first step towards creating a more equitable healthcare system. These disparities are not simply random occurrences, they are often the result of systemic issues and historical injustices. One powerful approach to addressing healthcare disparities is community based participatory research, or CBPR. CBPR is a collaborative research approach that involves community members in all aspects of the research process, from identifying the research in question to disseminating the findings. This ensures that the research is relevant to the community's needs and priorities, and that the solutions developed are culturally appropriate and sustainable. By working in partnership with communities, researchers can gain a deeper understanding of the factors that contribute to healthcare disparities and develop more effective interventions. CBPR empowers communities to take control of their own health and well being. To gain a comprehensive understanding of healthcare disparities, it is important to use a mixed methods data collection strategy. This involves combining quantitative data, such as surveys and statistical analysis, with qualitative data, such as interviews and focus groups. Quantitative data can help us identify patterns and trends, while qualitative data can provide rich, contextual information about people's experiences. By combining these two types of data, we can gain a more complete and nuanced understanding of the complex factors that contribute to healthcare disparities. Surveys can provide valuable data on access to care, utilization patterns, and patient satisfaction, while interviews can provide insights into the lived experiences of individuals and communities. Ethical considerations are paramount in healthcare research, especially when working with vulnerable populations. It is essential to obtain informed consent from participants, protect their privacy and confidentiality, and ensure that the research is conducted in a way that is respectful and culturally sensitive. Researchers must be aware of potential power imbalances and take steps to mitigate them. Upholding ethical principles is essential for building trust with communities and ensuring that research is conducted in a responsible and ethical manner. Healthcare disparities are often the result of systemic factors such as racism, discrimination, and poverty. These factors create barriers to healthcare access and contribute to poorer health outcomes for marginalized groups. To address healthcare disparities effectively, we must understand these systemic factors and work to dismantle them. This requires a multi pronged approach that includes policy changes, community based interventions, and efforts to address social determinants of health. We must also be willing to confront uncomfortable truths about our society and work to create a more just and equitable system for all. Racial and ethnic minorities face significant disparities in healthcare outcomes and access. Research indicates serious issues with skin cancer diagnoses and treatment in these populations. Addressing misconceptions and providing quality preventative care is essential for equity. Socioeconomic factors such as income, education, employment, and housing play a significant role in shaping health outcomes. People who live in poverty, lack access to education, or experience housing instability are more likely to experience poor health outcomes. Addressing these socioeconomic determinants of health is essential for reducing healthcare disparities. This requires a collaborative effort involving healthcare providers, policymakers, and community organizations. We must work together to create communities that support health and well being for all residents. Chronic diseases such as diabetes, heart disease, and cancer disproportionately affect vulnerable populations, including racial and ethnic minorities, low income individuals, and people with disabilities. These populations often face barriers to accessing preventative care and managing their chronic conditions. To address this issue, we must improve access to affordable health care, promote healthy lifestyles, and provide culturally competent care. We must also work to address the social determinants of health that contribute to chronic disease. The rise of telemedicine holds great promise for improving healthcare access, but it also risks exacerbating existing disparities. The digital divide refers to the gap between those who have access to technology and the internet and those who do not. Low, low income individuals, rural residents, and older adults are less likely to have access to these resources, which limits their ability to participate in telemedicine. To ensure that telemedicine benefits all populations, we must address the digital divide by expanding access to technology and providing digital literacy training. Achieving health equity requires the involvement of all stakeholders, including healthcare providers, policymakers, community organizations, and individuals. By working together, we can identify and address the root causes of healthcare disparities and develop effective solutions. It's essential to create a culture of collaboration and shared responsibility. Policy changes are essential for creating a more equitable healthcare system. This includes policies that expand access to affordable healthcare, address social determinants of health, and promote health equity. Policymakers must also be held accountable for ensuring that their policies do not perpetuate healthcare disparities. Health education and community awareness campaigns play a crucial role in empowering individuals to take control of their health. By providing people with the knowledge and skills they need to make informed decisions, we can help them prevent disease and manage chronic conditions. These campaigns should be culturally appropriate and tailored to the specific needs of the community. Finally, continuous research and data evaluation are essential for monitoring progress and identifying new challenges. By tracking health outcomes and access to care, we can identify areas where disparities persist and develop targeted interventions. Addressing healthcare disparities requires a multifaceted approach that includes community engagement, policy changes, and a commitment to ethical principles. By working together, we can create more equitable healthcare systems where everyone has the opportunity to live a healthy life. Thank you.